actually do the hand augmentation to eliminate some of the veininess and some of these tendons. Now this is a relatively very young hand, so it may not be the ultimate candidate, but it will work. All right, so what we have done is numb the area with a topical anesthetic called BLT, which is benzocaine, lidocaine, and tetracaine, and then we sterilized it. The medication that's being used is RADIESSE, 1.5 cc, except it is diluted with 2% lidocaine because I don't want it to get very thick. I want to spread all over the place. So the procedure is relatively very simple. Tent the skin. Let me know if you feel any discomfort. You should not feel any discomfort. Needle stick. How was it? Any discomfort?
Nope.
Okay. So we fill it. It gets lumpy. So at the beginning, I've already explained to our patient not to get scared. It looks like a rock. And then I'll spread it in a minute. Thank you. Relax. Obviously, I need to, the veins are visible, so I need to go around it or under it. Otherwise, she's going to be badly bruised. Needle stick. You want to inject it very superficially to avoid the nerve endings and the muscle structure. As you can see, there's not a lot of bleeding. Okay, needle stick. Those crackling that you're hearing is perfectly normal. Thank you. So I'm going to use some ultrasound gel to make my movement a little bit gentler for the patient. And my job is to just move it around like literally silly putty. Are you comfortable?
Mm-hmm.
Okay. Usually for hand, again, she's in a perfect shape. At the minimum, you will need, or I will need, one syringe of 1.5 cc RADIESSE. Sometimes I need to do more.
Now that's per hand?
Per hand, once,
Okay.
yeah. Okay, let me have my other syringe, please. Oh, okay. I'm not hurting you, am I? All right.
It's like a little massage.
Well, I'm happy to hear that. If it's not diluted, it's gonna hurt. I've learned that. No, this one. Okay, I got it. Okay, do you like it as of now?
Yes.
So now I'm gonna cover these areas. So we did the top. This oozing of blood is not that issue. Needle stick. Are you okay?
Mm-hmm.
I do not over treat because it's going to get bigger a little bit. By the way, I'm sorry for using your leg as a stabilizer.
Now this will help stimulate the collagen.
Absolutely, yeah, that's what I'm talking about. So originally, I don't want to over treat. It's going to get bigger, and then it's going to stimulate the internal collagen tissue, and over a span of a couple of months, actually the body is going to build its own collagen around it.
So this product is excellent for hands and cheeks.
Very much so. Very, very much so. The other question they asked me, how long does it last? I expect at least a minimum 12 to 14 months. I've seen it longer. Every now and then I've seen it shorter. It's calcium, so if the patient is really calcium deficient, is going to absorb it. But most people are not. What do you think?
Beautiful.
You see any difference?
So good.
But again, for caution, for people who are going to watch this and they want to do this, make sure to avoid the veins, make sure to avoid the tendons. You don't want to entrap them. So you got to go around it. Okay? Okay, so I'm good. We're going to trade side, and then I'm going to ask you to put a little bit of pressure. Actually, ideally, give her a gauze. That's the best technique that I've learned throughout the years of doing this. Best way to spread it. Actually, I'm going to ask the patient to sit on it. but yeah, just literally good. That's where the tissue loss and volume loss is. So in this case, which each hand is different than the other hand. On the other hand was predominantly in the middle. On this hand, predominantly is on ulnar side. Maybe a little bit in the middle, but the radial side is completely full. So I'm not going to inject this side at all. I'm going to spend most of my time in this area. Okay? So once again, we are seeing a couple of really, really thick veins. So hopefully I'm smart enough not to hit the vein. And the technique is you always tent it. This way you're avoiding hitting the vein. So are you okay?
Mm-hmm.
Yeah, that lump is gonna go away, so don't panic. I had few patients originally got panicky.
I trust you.
I appreciate that. You're not my first rodeo, but thank you. By the way, I've only been to a rodeo once. So, technically. That's off record.
Yeah.
Love it. That's good. I love it. Are you okay?
Yes.
Perfect. Okay, you can discard this. Thank you. Thank you. Once again, I'm using ultrasound gel, and I'm going to spread it. That's nice. Actually, you're responding amazing. I love it. I really, this is one of those things I enjoy. It's amazing. And by the way, if people ask me what product I'm using, the only product I use for hand is RADIESSE. I don't use any other product. I don't think anybody has a consistency. Perfect. Okay. So we're going to use our second syringe. So I'm going to do okay. Now this is tricky. I don't know if the camera is showing it or not. The vein is going straight down. Have your fingers crossed. The other hand. I'm kidding.
Oh gosh.
No.
And toes.
Okay, good. Perfect. I love it. All right. Thank you. Didn't hit it. Got lucky.
I mean,
I'm
thank
kidding.
goodness.
The ones that are going north-south are very difficult because it's hard to go around it. There are ways to do it. As you notice, I did it. I didn't hit your vein. Every now and then bruising happens, but it's not unique. Actually, it is unique. It's not frequently occurring. I have some left, right? 0.25? Okay. Oh, I love that. I'm going to do some up there. I have two choices for the product. Do you want more here or here?
Whatever you think.
I think here. I love this. This is full. I don't want to make you plump.
Don't need it.
You're okay. I'm not hurting, am I?
No.
Yeah, right there. All right, thank you. Just drop. Relax. Gauze, please. Thank you. Perfect. Thank you. Yeah, thank you. So in total, we used 2 syringes of RADIESSE 1.5 cc. 1 syringe in each cc. It was diluted, each syringe with 0.5 cc of lidocaine, 2% without epinephrine. The reason I don't use epinephrine because I do not want vasoconstriction and blanchingness. That gives me, oh, I like that. That's very good. Okay, I'm good. Give it for, again, 4x4, please. How do you like it?
Perfect.
All right. The purpose is when you're not using your finger is even, and when you're using finger, of course, it's gonna. Okay, under your butt. Let me see the other one now. Oh yeah, check that out. How about that? All right, it's gonna get a lot better.